everyone, and welcome to the PCA webinar. First, I would like to start by acknowledging the traditional owners of the land where I work and live, which is the land of the Yugambeh language region families in Southeast Queensland. We also recognize the traditional owners of the lands where we each are joining us from today, and acknowledge any First Nations people attending this webinar. We also celebrate the stories, culture, and traditions of Aboriginal and Torres Strait Islanders from all communities who work and live on this land, and I pay my respect to elders, past, present, and emerging. Please share in the chat from which land you are joining us from today. I'd like to remind you all that today's during the registration and throughout the webinar, personal details may be collected. These details will be used to record your attendance and communicate with you about the training. Additionally, this information may be shared with our partnering organization, including the Australian Digital Healthcare Agency, Brisbane South PHN, Brisbane North PHN, Darling Downs and Westmoreton PHN, and all in accordance with the Gold Coast PHN privacy policy. For more information, please view the privacy policy on the Gold Coast PHN website. Now let's begin by establishing the webinar housekeeping rules. This webinar is being recorded. If you prefer not to be recorded, please turn off your camera. The recording will be available on the GCPHN website within the next few days. Please keep your microphone muted unless you are speaking to minimize background noise. For questions and comments, please use the chat option and post them to everyone. If you have questions or comments, please use the raise hand feature to get the facilitator's attention. Please be respectful to all participants. Keep questions and comments relevant to the topic. And if you encounter any technical issues, please notify us through the chat and we will assist you as soon as possible. Any materials or slides used during the presentation will be shared with participants after the webinar. We value your feedback, and a survey will be provided at the end of the session, and please take a few moments to share your thoughts. Lastly, we hope you find the webinar informative and engaging, and thank you for joining us and enjoy the session. Now I will share the floor with Jai Waddell, which is the Acting Program Manager for Allied Health and Digital Adoption from the National Program Delivery Branch from the Australian Digital Healthcare Agency. Welcome, Jai.
Hi, everybody. Thank you so much for having me. I really appreciate everyone taking the time. I know it's late in the afternoon, and post 4 o'clock it can get a little bit hard. So thank you so much for joining me today. I'll just quickly share my screen. Everyone can see that, I hope. Yep, got a thumbs up. That's fantastic. Okay. So Provider Connect Australia. So what is it? It's an initiative of the Australian Digital Health Agency, commonly referred to as PCA. The idea of PCA is to connect providers with their business partners. Now, when we talk about business partners in the context of PCA, we're essentially talking about anybody that helps you with your healthcare service delivery. So we're talking things like private health insurers, booking agents, the National Health Services Directory, your peak bodies, long-term things like Medicare, Services Australia, and things like that. The idea behind PCA is to streamline registration and ongoing updates and enable healthcare providers to maintain a single source of truth of their business details. So a lot of the data that PCA deals in is information that's largely in the public sphere already and is actually obtainable by anybody. But the thing is, a lot of the time you're off searching in multiple places trying to find out that information. So contact information, addresses, people that work at a certain practice. So PCA is part of the is largely part of supporting healthcare interoperability. In our recently released National Digital Health Strategy, PCA was named as one of our key change enablers. So the agency views PCA as one of those long-term projects as far as getting people on board and supporting that sharing of data across the health ecosystem. So as I kind of mentioned, there's a lot of challenges for healthcare providers currently. Anecdotally, we've been told by various organisations that when they have a new practitioner join their practice, they're alerting 13, 14, 15 different organisations that they've had this new practitioner come on board, and then they were needing to share basically the same details across all of those organizations. So things like your service directories, booking systems, funders, your primary health networks, communication services, diagnostic services, public and private hospitals, those professional associations and peak bodies. So there's a lot of people that we're sharing information with, and for the most part, that's happening in silo. So the PCA rollout. PCA originally started as what we used to refer to as the clinical vaccine finder. So it came about during COVID times, and it was essentially there to enable consumers to find somewhere that they could obtain a COVID vaccination. It went through what was essentially a pilot phase in early 2023, and that started with mainly registering general practices for the initiative. Beyond that, we're now in full-blown delivery mode. So that started about August, September last year, and as I said, quite a new product in the grand scheme of things. We're progressively trying to roll this out across all kinds of health professions. So in particular, at the moment, I'm doing a lot of engagement in the allied health space, and also in those remote and rural type settings. So how PCA works, you'll see on the left-hand side here, so we've got our healthcare provider organisations, so primary care, allied health, pharmacy specialists, hospitals, jurisdictions. They would register for PCA as a healthcare providing organisation, and there they would feed their information into PCA. So that's their service delivery details, like their practice name, the types of services they provide, contact details, practitioners, banking details. From there, it goes through a verification service. So it gets verified against non-public data held by the ABR, the HI service, Medicare, and also the APRA data feed. Once that information's been verified, it's then able to be fed out to your business partners. So you can see all those on the right-hand side. In particular, we've got the NHSD highlighted because that's that Health Direct website. So you can input your practice details. It would then flow through to Health Direct and be available on their website in a matter of hours. That then has a direct onflow to patients and consumers where they're able to see the healthcare providing organisations in their area and what services they're able to access from those providers. So the main benefits for healthcare providers is reducing that duplication, making sure that there's less forms to complete, and ensuring that all business partners have the same information. The idea of reducing time saving time and reducing the amount of follow-up and redirecting of messages and information that gets received in error. Streamlining processes. So in the recent PCA release that came out on the 28th of May, for those business partners that have chosen to integrate with our Fire API, which I will talk about shortly, there's the ability to automatically pre-populate their area's forms. So if we use Medicare as an example, where they've got their banking details forms, those exist because of legislation. So that they need to have those forms hand signed, which means PCA long term would be able to pre-populate that data into that form, and you'd be able to give that to the provider to then sign and send back to Medicare. Improved awareness. So the knowledge that within this service directory, so your Health Direct, for example, there's complete and up-to-date listings of services that are services that are able to be provided at your practice. In the update that's just come out on the 28th of May, there was also an additional functionality that was added from business partner perspective, where if they recognize that some data appears to be out of date or perhaps incorrect, so for example, you know that the practice is in Brisbane, and yet for some reason they've provided a phone number with a WA postcode, a WA phone number, for example, you would be able to contact that business using PCA and go, hey, you're able to check this, it seems like it's out of date or maybe incorrect. There's also then that knowledge that once the provider fixes it from their end, it then flows out to all their business partners. So it makes sure that that information is kept accurate across the board. So the main benefits for our business partners are timely notifications of changes when healthcare providers do change their details, the reduction in data entry errors, the knowledge that business partners are receiving validated and complete information, and once again, that automatic pre-filling of registration forms. So as a business partner, whilst this isn't necessarily relevant for healthcare providers, it is important to know the way that this data is received by your business partners. So as a business partner, they have three options. They can receive just an email notification of when changes occur. So the example would be I make an update to my address of my practice. An email is then sent to my business partners to say, hello, X practice has changed their address. Then you would be able, X practice has made some changes to their details. The PCA business partner would then log into the portal and they would be able to see those changes and make sure that they're reflected in their relevant systems. It's also the option to export data as a delimited text file. So that comes into, they would log into the portal and at any time they could download the data on their connected healthcare providers and integrate that with their systems. And the third most advanced option is integration with the PCA Fire API. What that does is that allows your business partners to receive information almost instantaneously when information is changed. So the National Health Services Directory, that's Health Direct, they're integrated with the Fire API, and if you were to make a change to your business details in PCA, that would reflect on the Health Direct website in a matter of hours. They quote us 24 hours, but it happens much sooner than that. Usually 1 to 2 hours max. So for further information and support, I've given a very, very quick run through of what PCA is there, and I intend to do some demonstration of PCA very shortly. But before I do, I just want to give a couple of links to everybody. So to access the website, that would just be digitalhealth.gov.au/PCA. On that page, you're able to access a number of instructional and helpful guides that can help you with registering for PCA. However, we also have a dedicated assistance team that's able to help you with registering. And their contact number is 02 6223 0741. Now, that team is not your traditional help desk. Their sole purpose is to help people register with PCA. So there's no kind of genuine wait time when you call through to that phone number. It's not one of those 1-800 numbers, those 1300 numbers. You'll go through and maybe wait a minute or two for someone to become available to answer your call. They're incredibly knowledgeable, and they're more than willing to step you through each process as far as PCA is concerned. If it's something that you need to revisit, you can even organise a time for them to call you back at your earliest convenience so that they can help you down the track. We've also got a contact email address, which I've got there, which is pca@digitalhealth.gov.au. That email inbox is manned by myself, and then also the lovely Sonia, who I believe is in the webinar as well. If you've ever got any questions, you've got concerns, you want some help, please reach out to that mailbox and we'll get back to you almost immediately as well. Sonia runs a tight ship when it comes to that mailbox, and definitely keeps me on track when it comes to that mailbox. So by all means, if you've got any questions, please send those through.
Sorry, Jerry, can you please repeat the number again?
Yes,
so I can put it in the chat? It's 02
6223
Yeah.
0741.
Thank you.
No problem at all. Now, I'll pause there very quickly. Does anybody have any questions, or was there something that you'd like me to talk a little bit more in detail about?
No questions so far?
No questions.
I was going to say, sorry, I'm going to jump in. I do actually have a question.
Yes.
Is there any way or future planning to share from practice to practice rather than practice to business partner? Because for instance, I had an example recently with a GP practice changing address, but then they had to let the allied health know.
Yeah, it's something that has been discussed, I think, a number of times. Our PCA product team at the moment, so the ones that actually develop the product, are deep in what they would call discovery currently, where they're mapping out the new features that they intend to add for our October release. So PCA does 2 releases per year. that is a suggestion that has currently been tabled and is sitting within their backlog. Whether it gets prioritized, I probably can't comment on this exact moment. However, it's definitely something that's been raised, and I agree. I can see heaps of use cases for that. It's largely getting across, I suppose, that whether or not it's a genuine priority from the product team's perspective, and that's what they'll work through at the moment. I do think that it would be something that would come in future. It's basically just when that actually occurs.
Awesome, thank you.
No problem. I'd also like to mention, so very, very quickly, I've kind of banged on a little bit about the recent update that we've had to PCA, but it was actually quite an exciting one. Mentioned those two other pieces of functionality before, but there's also been the recent addition of your IAR score to PCA, and that had come directly from, I suppose, industry feedback, in the sense that that was something that had been requested from a number of PHNs, and it also been requested by a number of practitioners. So that's where that feedback has become really, really important. We'd also had banking details added to PCA, which also came from requests and from feedback from users. Another piece of functionality that has been added to PCA, which is still very much in its early days, but I think very important for people to be aware of. PCA now has the capability to integrate with your clinical information system. Now, when I say it has the capability to do so, I don't want that. I don't want everyone to think I need to contact my software provider tomorrow and they'll get it done for me. It's not that simple. However, because PCA now has that capability, it means we're now able to fully engage with the software industry and start getting those conversations moving so that we can get that integration with those clinical information systems. So, as I said, we're right on we're very early days as far as this is concerned. However, now that the capability exists, it means that it'll be able to be implemented down the track. And we're really looking forward to engaging with some of these software providers so that we can try and get it happening.
In a nutshell, it's capable, not available.
Capable, not available. That way, largely because it will require development from the clinical information side. And there's obviously a cost associated with that from their perspective. So I will point out here, PCA is a free product. PCA will always be a free product. However, when you have to integrate with an API, there's always going to be development, which has a cost on that side.
Thank you.
Okay, if there's no questions, I might really quickly jump into a demonstration of the system itself. So I'll just close out of this, and I hope everyone can see that one.
Yes.
Excellent. So on my screen, you can see the login page for Proda, Provider Digital Access. I'm sure most of you are familiar with Proda by now, given that it has been the way healthcare professionals kind of interact with Services Australia for a really long time. It's also kind of been extended out to being used for a number of other government programs and initiatives. I used to work for Proda a couple of years ago, so I'm actually incredibly passionate about Proda. But I understand there are some challenges with Proda, and I understand there's some use challenges as well. So I'm just going to quickly log into a test environment here. Excellent. Just wait for my verification code. Okay, so I'm in Proda. At the top, you can see my linked services, but below that, we've got my available services. If I scroll all the way down to the bottom, we'll see the lovely Provider Connect Australia logo. So I'll click on that. It's going to bring me into the Provider Connect Australia portal. Now, you can see I've got a couple of organisations here. When you first access PCA for the first time, it will bring you to this page here. It's just because I've got some organisations. Now, once you access PCA for the first time, there's a number of things that can help you get started. So there's register and setup guidance, which takes you to some of those really handy user guides, how to register as a healthcare organisation, and then also find out more about PCA. So all of those take you to some really useful links. But for our purposes, to register an organisation, you would then just hit your organisations, and it's going to bring up an option at the top here that allows you to add an organisation. So I'll select add. You can see here it's pulled my information straight from Proda. So this contact number is in my Proda account. This email address is in my Proda account. I can untick that and I can enter in my own details if I like. I then need to enter in an ABN to register. So I'll pop in an ABN. Excellent. So what this does is this is searching the publicly available data on what is essentially the ABN lookup. So it accesses. Sorry, I've just seen Summer's question. Can everyone else see my screen?
Yes.
Yes, John, you
Yes.
can.
Yes. Okay. Summer, I'm not too sure how you're accessing. But sometimes I find if I leave and re-enter the meeting, I can access the screen sharing. So you can see here it's pulled up the it's pulled up the ABN from the publicly available data. And from here I just enter my organization contact details. So I'll pop in my mobile number, my email address for legal notices, and then you can also provide your website. It then asks you for your postal address, which I will type in. And I'll hit add organization. Congratulations, you're basically 50% of the way there for registering for Provider Connect Australia. That was the simplest part of PCA. We now get into the slightly more complex stuff, which is the legal document side. So after I've added my organisation, I then need to sign and upload 2 documents. So there's 2 documents that I need to provide. Before that, though, I need to advise the system who I am in relation to the business. So this is one of those security things to make sure that people that are registering these organisations are actually able to act on behalf of that organisation. So I've got 2 options. I can sign the participation agreement, or someone else will be signing the participation agreement. So if we go someone else, we say the director. The director can then provide authority, but we'll go down the simple route, which is I will be signing the participation agreement so that I can demonstrate it. So in this instance, I will say that I'm the delegated authority. So that's someone that is perhaps working for the organisation and has gone through these steps. One of the things that I find quite often is that the owners of organisations may not necessarily have Proda accounts, so they may not be the person that, you know, is in the best position to do this. I understand there's challenges with registering for Proda, and so it's not as simple as going to your director, hey, need you to register for this, and then I need you to register for this. So this allows for an employee essentially to register the business. In doing that, they will nominate themselves as the delegated authority, give their name, what their job title is. So I'll just say manager. Name. And I'll hit save. Because I wouldn't be registered on any of these ABR documents, I need to provide 2 pieces of documentation. So the first will be a participation agreement, which I'm able to electronically sign. So I'll bring that up. Copy that password. And I'll hit continue. It's going to bring up the basic agreement that you're signing when you agree to use PCA, and explains how the data will be used. We scroll right to the bottom and it's going to ask me to sign. I'll sign that and select click to sign. And that part is done. So I've now agreed to participate in PCA. Now I need to provide the evidence that I'm able to act on behalf of the business. So I've chosen the statutory declaration option. So I'm going to hit download to sign. Now, this one, unfortunately, cannot be done electronically. Given that it's a statutory declaration, it does need to be witnessed. So in this instance, you can see it's populated my details that I've already provided. I would fill in my statutory declaration, and then I would need to get it witnessed by one of the following people. It's not just a JP that can witness statutory declarations. There's a lot of people that can witness them nowadays. Once I've done that, I would then just need to upload it. So I would select browse for a file, upload that. And then I would submit for assessment. From there, you've essentially registered for PCA. It now goes through a validation process where the Digital Health Agency essentially reviews the application and makes sure that you are the person that should be acting on behalf of this organisation. If there's any issues, they will reach out and get in contact with you. It's not as simple as just rejecting. They will follow up to make sure that they've got all the information that they need. Then, if you navigate back, you will see it's sitting as active. However, if I select it, it will say that it's still being reviewed. So it's basically still pending approval. Once it's been approved, you will actually receive an email. So I will half put my emails on the screen. It doesn't matter, they're all up here. You can essentially see I'm receiving emails along the way. Don't look at my email inbox. It's a nightmare. I normally have 100 things to do. But essentially, you can see I'm receiving emails along the way that are essentially informing me of the journey that I'm on. If I had to log out for any reason and come back, I'm able to just pick that up from wherever I left off. It's not you've stopped and then you've got to start from scratch. You can continue on with the journey that you're on. So I'm going to pause there because that's registration covered. Does anyone have any questions about registration? No, excellent. Okay, I'm now
one.
Yes.
I have one. Can the Digital Commonwealth Stat Deck be utilized for this purpose? As for that, you can use your MyGov account and you don't need a physical witness?
Not at this stage, but it is something that's being 100% something that's being investigated. And I actually raised this the other day. I was like, wait, why aren't we using the MyGov Stat Deck? So yes, definitely something that is being explored. Once again, it's an implementation thing, but yeah, I think that anything that can avoid people printing out pieces of paper, fantastic.
And shortening the time that you will need to find a witness, this and that, as that's already available.
Yeah, 100%. And I'm right behind that. I think I think from a MyGov perspective, that is a fantastic initiative. And the people that put the work into that should be really proud of themselves. It's a fantastic feature.
So in a nutshell, it's not available at the moment for PCA.
Not right now, no.
Thank you.
But they deserve a pat on the back for doing such a good job. So I've just jumped into another test environment. This will likely not work the first time, but we will see. No, excellent. Okay, I am here. So you can see here, this is an organisation that is active and is actively publishing information. It's called the Hornsby Central Medical Centre. This is not a real medical centre. It was made up for testing purposes. So if it by some coincidence, is the same as another practice, I will apologise in advance. You can see this organisation has a fair bit going on in it, but none of that is really important for our demonstration. So I'll quickly close those up. Once I've created my organisation, you'll see this part here would be here. These ones will not be. I would add my location. So once I've created my organisation, I then want to let everyone know the actual location that that organisation is at. So we'll name the organisation. We'll just call it Digital Health Test. Select the kind of location it is. So I'll say it's a physical location. You put the kind of amenities that it has. So I will put a couple in and I'll show you why this is important very soon. Let's say paid parking. Don't wish to provide, don't wish to provide. This is just for speed of me getting through it, but yes, you would normally enter in all of those details. You can also pull the stuff directly from the organisation itself. from when you registered it with the ABN. So if you were a location that had an ABN and was a single location, you could just pull that information straight from your initial registration. This is mainly to support those large organisations that might have multiple locations. They can register each location individually and maintain those details separately. I'll use this address and I'll select add location. Great. So I've added my location. From there, I'm able to do a number of things. So I can name the kind of services that the organisation performs. I can add additional users that may want to access and use PCA on behalf of the organisation. So, you know, people change jobs, for example. You may not want a single person that is the only person, you know, the keeper of the keys to PCA. So you're able to assign as many users as you want to the PCA system once you've registered the organisation. And that can be done using just a PRODA RA number. Got your partner identifiers and then audit events. So you're able to see everything that has happened for the organisation within PCA. What I'd like to do though is really quickly show adding a healthcare service. So this is where you're able to let your business partners know all the services that your organisation performs. So let's say we do COVID vaccinations. You put a brief description. You need to say the start date. So I'll say it started on what's today's date? 5th of the 6th. Yes, we're accepting new patients. We do mixed billing. You can see that IAR levels of care are there. And then it asks if I wish to publish this information. So I'll select no. And I'll add that healthcare service. Once I've got that added and I select publish to partner services, I can then choose who I want that information to go to. So obviously these are all test services, but let's say I want it to go to this one. I would tick their box, accept and proceed. I can choose to add bank account details if I like. I can choose to add practitioners to those bank accounts if I like. And then I can confirm and publish. So I'm going to hit publish now. And I'm now confident that that's gone through to each of the business partners that I've selected. What I'd like to show is this in practice. So if we go to Health Direct, and I'll give my local GP a plug, mainly because I know that they've got information in the Health Direct site. So all of this information that's here, opening times, about this service, this is all information that could have come from PCA. Now, Health Direct has the ability for you to submit information to them directly, and they've always had that. However, that's a manual process where they receive a form and they process the form. Using the Fire API in PCA, they receive this data and it updates on this website automatically. So this is all information that they could have input on PCA and it gets directed straight to Health Direct. This is one of those real use cases that I like to show, mainly because it really shows what I've just essentially entered in. Once I've published, I can then choose other partner services if I wanted to do them individually. Every single partner service, so that's your business partners, they've got their own information use statement that essentially tells you how they intend to use your information. And that's something that we collect from them as part of the onboarding process when they become a business partner, and we ensure that then that reflects correctly in the portal. So you're essentially able to see how every single organization intends to use your data long term. I think that's about it. I do want to quickly bring up our website as well. Do a quick plug for this before. So that's digitalhealth.gov.au/PCA. If you scroll to the very bottom, you'll see our participating business partners. So right now we've got 37 business partners in total. So we've got a number of directory systems. So that Health Hunter, they're a brand new one that we've just had come on board. We've got Health Direct Australia, which I was just demonstrating, and we've got Precedence Healthcare. We've got all of our PHNs on board. We're really heavily engaging with the peak bodies and associations at the moment to get them on board. So currently we've got a PODA and we've got the Australasian Association and Register of Practicing Nutritionists. Quite a mouthful, that one, but they came on board, I think, 2 weeks ago. And we've just started to have some nutritionists on board from that, which has been fantastic. There's a number of other peak bodies that are right on the cusp of kind of falling over that line as business partners. Just not allowed to discuss them until we've actually got their signatures on some papers. So apologies for that, but there's definitely some more professional associations and peaks coming on board. Got our public health services, so that's eHealth New South Wales, and then some secure messaging providers, so Telstra Health, Foxo, and Recare. Everyone in this meeting are Queenslanders, right? Yeah. So I think for you guys currently, some of the best value you'd probably see is from that Health Direct website. However, we are engaging with a couple of groups in Queensland currently as well that we'd like to see come on board as business partners. Okay. That brings me to the end of my presentation. I've wrapped up a little bit early, but I wanted to throw back to everyone and see if we had any questions. I'd also like to replug that phone number and give a very particular person that you should speak to. If you were to call that number tomorrow and ask to speak to someone named Peter, he's incredibly knowledgeable about PCA, especially when it comes to its actual use cases and adding services, things like that, that real in-depth guidance around using PCA. So if tomorrow, you had some time and you wanted to register, by all means, call through that number, ask to speak with Peter, and he'll be more than happy to help you.
And while you're on the page, I would like to recognize that beautiful small video that's on the page that gives you a 2-minute overview on the right corner. That's at the moment. That's
this one.
Yes. Yeah. It gives you a very brief 2-minute overview of how to register. It's very simple, and I really would like everyone to see it. It's really short and it's very beautiful. Good job.
Thank you. Thank you, everyone, so much for your time. I do really appreciate it. Like I said, I know it's hard to come to things late in the afternoon, so it's been fantastic that we've had such a turnout. And Sonia's phone number's there, and Peter's there as well. I can assure you, Peter can't wait to speak to everybody. As I miss it, what is the purpose of? Yeah, Peter. So fantastic. So as a sole practitioner, PCA is still of value in that you can still get yourself listed on the National Health Services Directory, so you could appear as a practitioner on Health Direct. Also, longer term, the vision will be that you will be able to, update just your details and share them with, things like private health insurers or I don't want to say Medicare is happening, but Medicare is something long term that we would like to see. So it would be a way to manage your details longer term across a lot of organisations. What I will say is that because PCA is still such a new product for the agency and they're kind of going all in on it, getting in on the ground floor is quite a good thing at the moment because there's lots of support available. Without throwing Services Australia under the bus, you need assistance with your Proto account now and you've got to call through to one of those 1-800 numbers. There's a substantial amount of time before you can receive assistance. Given that we are new and young, I suppose we're a little bit more dynamic as far as how we can help and how quickly we can assist with that kind of stuff.
Anyone else with questions? Thank you, Jay. And before we finish, I would like to ask any of you to share your insights on today's webinar. You can scan the QR code or simply hit the link on the chat that will be posted soon and just finish the survey. That's about only 4 questions. I will leave the slide just for a second so that you can scan the QR code if you wish to scan it. You can also click the link on the chat. It's already posted. And lastly, if you need any local support from your PHN, feel free to use the emails that are provided now on the screen. With this, I would like to wrap up the meeting to thank Jay and Sonia for attending. Thank you all for attending, and we hope that you find this very helpful, as we really did.